Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see all of you again. We have just finished celebrating International Women's Day, and you will be happy to know that this whole month I will be presenting these sessions on essential health topics related to women's health. In this series, we will be discussing the latest technologies, innovations, well-being solutions, and path-breaking treatments so that you can obtain freedom from diseases and illnesses that are hindering your good health. Today, we are going to be discussing a very important area of women's health, a phase that every woman has to go through and brings with it its own challenges, menopause and perimenopause. Menopause, as you all know, is the process when women go through that phase where their periods come to an end. It is a turning point or a milestone, not a disease, but it can have a huge impact on a woman's well-being. Menopause can bring physical discomfort from hot flashes, night sweats, and whatnot, and also emotional symptoms like irritability and feelings of sadness. And the transition to menopause is, of course, called perimenopause. Now, menopause and perimenopause are inevitable, but there is always the optimal way to cope. It's very important to understand what's happening to your body and embrace this next chapter in your life with self-compassion. And as you enter uncharted territory, it's comforting to know that every woman before you has navigated the same course and emerged mostly stronger and wiser on the other side. So now, to help you breeze through these phases of menopause and perimenopause before that, I am really delighted to welcome Dr. Mini Nambudri to give us her valuable insights and tips. Dr. Mini Nambudri is a senior consultant obstetrician and gynecologist at Apollo Hospitals, Navi, Mumbai. She comes with more than 21 years of experience. Her areas of interest include high-risk pregnancies, preventive oncology, and adolescent health, and also specializes in managing infertility. She is a member of various organizations and associations like the FOGC, Vice President. She is also a member of the Indian Menopause Society, member of the PCOS Society, the Trophoblastic Diseases Society, past secretary too of the Indian Menopause Society of Navi, Mumbai, also the organizing secretary for the annual conference of Maharashtra Obstetric and Gynecological Societies, and for many other such important associations. She's also been the speaker in various state and national level conferences and brings a very rich legacy of knowledge and expertise to Apollo Hospitals. Welcome, Doctor. Thank you so much for joining us on this very important session. To me, I think this is one of the most important sessions that every woman should know because it is inevitable and every woman has to go through it. So over to you now.
Thank you, Dr. Srinidhi, for that wonderful introduction. Yes, I'm very glad that you've taken up the topic of menopause and you've put you have rolled the stone very smoothly. See, now the longevity of women has increased. We all live till 80 to 90 years. That means at least 1/3 of our life we are spending in menopause. And we should revel in menopause. We should be so happy. We should spend our last years or our final few decades so happily. So let's see what we can do about. You must have read so many things about how bad menopause is and how difficult it is, but it is not like that. Now, as a person personally in the menopausal age, I know that it is actually a very liberating experience. It is a totally different experience, provided you prepare yourself for that. You can actually sail through menopause. You will feel a new person altogether. It is a new phase in life, just like how you go through adolescence so happy and carefree. You can go through menopause also happy and carefree. Take care of yourself. That is all I would like to tell you.
Reassuring to hear, because I think it's really, refreshing to hear you say that. So now we will go over to the topic itself. So we'll begin by asking you, what is actually menopause?
Okay, so menopause is where your ovaries stop functioning. Your ovaries stop functioning totally. And generally, we say menopause is after at least 1 year of not having period. Now, some people have a menopause by having a surgery done. They've had their uterus removed. These days, as you might already have experienced, those who have gone through it, we remove only the uterus. We do not remove the ovaries. So this is only a surgical menopause, but your ovaries are still active. So this is not actual menopause. So by definition, menopause is when the ovaries stop functioning, and at least 1 year through it. Only then we call it menopause.
So, what would be the signs of menopause, or apart from the periods, what else does a woman go through? And also, do all women go through everything?
So I wouldn't say just menopause. I would take it from the perimenopause side. See, I am a member of Foxy midlife committee also. So midlife is what I would like to talk about. That is what you call to refer to as perimenopause. So let's add life to midlife. That is what I would like to tell you. Midlife is when, around your early 40s, your perimenopause starts. The whole process takes about 5 to 10 years, the entire perimenopausal and menopausal thing. It's a gamut of play of your hormones. And generally, it starts off by shortening of cycles and followed by prolonged cycles. Some people have a very smooth transition from their periods, become less frequent, less bleeding, and stops. For some people, it is a terrible phase when the bleeding becomes too much and all that. Then what people come and talk to you about is, increased irritability, lack of sleep. They feel very anxious at things which they were not anxious about earlier. Your daughter goes off in the evening, she doesn't come early, you start feeling anxious, whereas she must have had some reason for her being late. So that is why she's not coming. But unnecessarily you become tensed. You start becoming very irritable to others. The others will start feeling that why is this lady around? She's creating trouble here. There's lack of sleep. You feel very angry, very emotional. Sometimes you feel like crying, and uncontrolled spells of crying. People sit in our OPD and start crying for no reason. There could be a problem with their urine. They can't hold urine for long. There is inadvertent passage of urine while you cough, while you sneeze. The moment you think that you have to go to the washroom, immediately there's a little leak before you reach the washroom. That is also very disturbing. You don't feel like going out often. You don't feel like mingling. You feel there's a smell of urine at all the times. There's a lack of, the skin becomes very rough, that elasticity is gone, becomes all wrinkled. There's a loss of hair. There could be some facial hair growing. And generally, those who are very conscious about themselves, feel that there are a lot of wrinkles on their face as well. The old charm is gone, but there's a new charm with menopause. It is not that the prettiness doesn't go, the beauty is within. So, I would say that you should all go through it very smoothly.
Sure. So now let us talk a little bit about, the actual, each one of these symptoms, because sometimes, each one of them by themselves can be quite bothersome. So if you could tell us how to cope with each of them. So we'll begin with one of the most serious consequences of, like the bone loss, which many people are not really that aware of, because that's not one of the symptoms or anything unless it becomes too late and there is fractures and things like that at an older age group. So we'll first start talking about that, about what happens, why should women have this additional bone loss, and what should be done, and from what age onwards.
So what keeps your bone fit? It is your estrogen. Only women have estrogen, and estrogen keeps your heart and your bones fit. So when your estrogen starts falling as you reach menopause, the bone loss starts. Bone loss starts from as early as maybe 35 to 40 years. I don't know how many of you do, but you're supposed to have your annual checkups, go through a DEXA scan, see how your bones are. If there is a bone loss, you check your vitamin D. You're supposed to replenish your vitamin D either by tablets or injections, or you go out in the sun. Every day, 15 to 20 minutes with a lot of exposed area would be a good way of increasing your vitamin D. And good calcium intake, maybe natural sources or from tablets, it doesn't matter. And how do you make sure that your calcium gets into your bones? By doing exercise, good weight bearing exercise, even walking. And there is no time where you can't start a new exercise. You can start a new exercise at any time, at any age. Now, I have started running after the age of 50. So, I mean, that is one way which I found out to remain fit. So you can start any exercise at any age. Exercise and vitamin D together gets the calcium into your bone. So get your annual checkups done, get your DEXA scan done. If there's any bone deficiency, start taking tablets and improve your lifestyle so that you can incorporate a lot of exercise, a lot of calcium in your diet, a lot of sunlight in your daily routine.
And also a little bit of weight training.
Yes. Weight training helps you in a lot way. You can go to the gym, you can run, you can walk. Even walking is a good way of weight. And cross training. Cross training also would be good.
Yes. I think now there are so many opportunities as compared
Yes.
to the past. I mean, where people could only walk at the most, but now there
You
are.
could dance. That's a good way of staying fit.
Yes, of course. So the other thing which I think is not only just a phenomenon of menopause, but I think it might be also a phenomenon of aging. So the quality of sleep, and there is a bit of insomnia that, or the poor quality sleep is quite a common symptom experienced by many people, and that eventually causes the weight gain and the tiredness and everything.
Yes. No,
This is
the
most important questions I think that we really
sleep.
want you to tell
Yeah.
us.
So sleep, deprivation of sleep can be in many ways. One is that the initiation of sleep is late. You don't get to sleep till very late. Some
Yeah.
people wake up very early, 2 o'clock, 3 o'clock in the night. They wake up and they don't know what to do. Otherwise, it can be even break of sleep. So there are a few reasons for this. Some women experience hot flashes. During perimenopause and menopause. Suddenly, when everybody else is feeling cold, some people sweat a lot, and then suddenly they feel cold. So all this, if it happens during the night, your sleep is lost. And as it is, menopause plays havoc with your sleep. So many people, and they don't feel fresh when they wake up in the morning. Another thing is, some people put on weight during menopause. Our basal metabolic rate comes down during menopause and perimenopause time. So you eat the same quantity of food, you do the same exercise, you find that your weight is increasing. So when you increase weight, there's something called obstructive sleep apnea, and that causes you to lose breath at night, and you wake up with a start. You may be snoring, and then you lose your breath altogether. So all this affects your sleep, and when your sleep is affected during the night, you are not feeling fresh in the daytime. You feel sleepy all the time. You don't find time for doing exercise. You might think that if you get some time, you might as well go and sleep. So that goes in a cycle. Then your weight increases again.
Yes. So what is the solution for that?
Number one would be to remain very, very active. If there is an OSA as in obstructive sleep apnea, it's because of your weight, or it could be of other reason. Get yourself tested. Go to a sleep clinic. Get your sleep test done. There is this thing called CPAP which you can keep, and that will help you with your sleep. Once you sleep well, you could even take some little small doses of medicines we do give to people who can't find sleep early. Your quality of life becomes much better. Not just your quality of life, the quality of life of the people around you also. Because you tend to be very irritable if you don't sleep well.
Yes.
So medicines and exercise and small, this OSA prevention can help you with your sleep.
Absolutely. Also, we say that menopause is the time after which the woman's risk of heart disease is equalized because of the lack of
Yes.
estrogen. So, what can be done to address that, and what kind of tests, screening tests, should the women have?
So the magic hormone, our protective estrogen, becomes less as you become older and older, and then you are liable to have all these problems. Nothing can be more important than your annual checkups. There you get your 2D echo done, or your stress test done, your ECG done. A lot of things can be found out, and that you get your cholesterol tested regularly. Your BP should be under control. These are times when your thyroid goes for a toss. You become diabetic, hypertensive. All this happens during this time, and all this along with the weight gain. It's not a good combination. So you have to keep yourself fit.
So it all boils down ultimately to your lifestyle and change,
Yes.
which helps. The other thing, of course, is people, most women develop vaginal dryness and also some of the incontinence issues. Now, this also has an indirect effect, or even a direct effect, on sexual relationships.
Yes.
And things change, relationships change, and suddenly, everything is different. So, What can women do to kind of cope with this kind of a situation? And
So even just as you said earlier, estrogen goes down and then the vaginal dryness sets in. And when the vaginal dryness sets in, your pH also gets different and you may have a lot of infections as well.
yes, yes.
So what we give is we give a lot of what do you say? We should not use too much of hot water in the perineum. Don't wash yourself too much. Some people use Dettol, so all that is to be avoided. Use just plain tap water at room temperature for cleaning yourself. And do I mean I wouldn't advise you to use all those vaginal douches and all which you get in the market. It really doesn't work. Just plain water. And if there is too much of trouble, especially if there's too much of dryness, no, that your vagina is burning all the time. So many people come to us like that. There's a burning sensation. So if your mouth goes dry, you don't feel good, isn't it? Just
Yeah.
like that, when your vagina goes dry, also it is very difficult. So we do help people by giving local estrogen in the form of creams. That will really help. That will help deal with the sexual problems as well. And for the incontinence, also it helps.
So I think the key message that you're telling us here is that all these things might seem, like inevitable or minor, but there is help available
Yes, there is
for
help
all of
available.
us, isn't it? So I think, it's worth it to go and sort it out rather than just keep it all kind of as a fact of inevitable and can't be.
Yes, yes. See, all that can be prevented or treated. Reach out to your doctors. They are all there to help you.
What about oral hormonal therapy? Because that was another thing which was quite popular initially, but then with this many side effects. So, who is in need of hormone replacement therapy?
Okay, good that you brought the topic up. I would say that it went out of vogue because of the wrong choice of people. When there was a WHI initiative that was done maybe in the late 90s and early 20s, and there, later on they found out that it was a wrong progesterone which was used and wrong set of people who were, the older age women were included in the trial. So now what we do is, soon after menopause, if there is any trouble, we start treatment soon after menopause, and after 60s we don't give. See, after 60s your risk of uh, breast cancer, your risk of stroke, everything increases per se. So along with hormones, and these are all confounding factors. So those who are an early menopause person, those immediately after menopause, they do very well with menstrual hormone replacement therapy. It is really, really, I mean, we are giving it often now. No, it has started coming back into vogue. And they need to be under close follow up. That is all.
And are there any people in which it is contraindicated?
Yes, those who are already having breast cancer, uterine cancer, all those people we do not give replacement therapies. And one thing is, you should not take any unsupervised medicines.
Yes.
Hormone replacement therapy is very good, but let it be under supervision only. Please don't take on your own. And there are some people, I have had a few experiences where they feel so nice that they don't stop. So we ask them to take it for some time, but they just don't want to stop. So it is to be taken for the prescribed dose for the prescribed time. Don't overdo it. That is all.
What about the other, today we get a variety of supplements like phytoestrogens, like, there are
Yes.
things like soya, isoflavones, and then there are red clover, all sorts of things like black cohosh. So are these safe? I mean, and do they also have the same effect? And in the sense, like, if it is contraindicated for you, is it okay to take these things? Because a lot of people now buy this over
Buy
the
this, no?
buy it from
So,
the
yeah. It is available online, I know.
yeah.
And there are actually no studies which have proven that they're very helpful. But it is good for some people. Some people feel good about taking it. They feel nice. So if you feel nice, you go ahead and take it. I mean,
And
but there are no
that's not
studies
likely
as such.
but that's not likely to cause, increase your
No,
risk of
not
cancer.
really, not really, not really.
Probably will not be effective, I guess. That's
Yeah,
not
it may not be very effective as good as hormones, but most probably they don't have any side effects as well. So if you're feeling nice about it, why not? You can.
sure. And the supplements we already discussed. So basically, it should be the calcium, and they should test the vitamin D. Or are
Yes,
there
vitamin D.
any other supplements that need to be taken at this stage?
It's basically calcium and vitamin. If you have a bone loss, then you will be given separately for building up your bones. And please check your cholesterol, thyroid, hypertension, diabetes, all those. These
Is
are all
it
your
true
friends.
that, the cholesterol also, once the estrogen levels change and everything, there is a chance that many menopausal women do have, or is it not
Yeah, that's
related
what
to
I said.
menopause?
No, that's what I said. Your basal metabolic rate is coming down. So all that adds on. Your weight also increases. And then you tend to be less careful about your food. So all that together does add on. This is the time when you need to be very, very vigilant about your health. You are liable to become hypothyroid, you're hypertensive, you're diabetes. Everything starts at this stage. At this stage, so you need to be very careful about your health.
So, is there something called post menopause? Because there is also, some people say that there is a period when all these things will go away, and then you kind of settle down into your your new
Phase
body,
of life. Yeah.
pace of
Yeah.
life.
So as I told you, menopause is 1 year of no periods, and maybe a year or two later, you are actually menopausal. Then most of these things settle down. Your hot flashes settle down. Dryness continues. Dryness does not settle down. It only becomes worse, and you tend to become. Then after a certain age, you don't tend to put on weight anymore. That is
Yeah,
also something to
that's what we see sometimes. Like after some time, they actually kind of become frail
become,
and thin.
yeah, they do that. So that is a post-menopausal phase. At that time, what I would like to emphasize is, any kind of bleeding that you have is to be reported immediately. You need to report that immediately post-menopausal. Again, take care of your health. See, why I'm talking about lifestyle is because if you are able to do very well at 50, if you're able to sit down and get up without support at the age of 50, you will be able to walk well at 80. You need to prepare yourself, you need to train yourself well so that you sail through your post-menopause.
Absolutely. So, what about this is the natural menopause that we spoke about. So, what happens when there is a hysterectomy or when there is an artificial
Artificial
menopause,
menopause.
premature in the sense, or are there any natural reasons why somebody attains menopause very early, like in their early
Yeah,
40s or something?
they do. So I'll take this surgical menopause first. Surgical menopause is, as you said, when your uterus is removed. But generally, we do not remove the ovaries. These days, suppose that when hysterectomy is done for bleeding, etc., we do not remove the ovaries. So the ovaries function for a longer time. So you have the troubles much later. But suppose there is something wrong, like a bad endometriosis, and unfortunately, you have to remove the ovaries, or in case of some malignancy, when there's an ovarian cancer, you have to remove the ovaries, then definitely there is a lot of trouble. These people are suddenly pushed into menopause when they're much younger than 40, when much younger than their natural age of menopause. They have a really bad time. All these symptoms come in very fast, and this hot flashes and sleeplessness, and or their bones are at a loss, their heart is at a loss. And about this premature menopause, you said, we call it primary ovarian failure these days. It is when you have this ovarian failure before the age of 40. These days, we do find people in their 20s also having premature menopause. So they all have this, they have life tough for them because of all these symptoms. We put all of them on hormone replacement therapy because they require it for their bones and their health and their heart and their overall health.
Absolutely. So the other important aspect is, the psychological part of menopause, where many women go through, as you said, a heightened anxiety, or there is a depression, or they feel sad. Is there anything that, apart from, yes, I know that lifestyle changes like exercise can make you feel good. So is there, when is it something that they need to kind of take, counseling, or even in perimenopause, there are people who develop very severe psychological symptoms, and they feel that in fact their whole every day is like a PMS for them, is what they say, because everything is so irregular. So what would be your top coping tip for them?
So this kind of issue is there for everyone, not just there's no distinction of housewives or working women or like. Many times, what happens is your children are all gone away. Your husband is busy working. Your own parents or your in-laws are there with you, and they are not well. They are old. You are also getting older, and you are not able to do everything as you have been able to, as you have been doing earlier. So all this causes a lot of stress. You need to have a me time, a little bit of time for yourself, which many people find it difficult to get.
Yes.
I would suggest that, if your quality of life is affected and the quality of life of the people around you are affected, then it's time for time to take help. You can't go on suffering in silence. You need to take help. You can go for a counseling. You can go out with your friends, rather than your family. I would sometimes suggest you, all of you get together and go out somewhere. You'll find it more enjoyable than going with a family, because going with a family is only a change of venue. The people are the same. So you could go out with your friends and enjoy a bit more. Yes, you can take help. You can take a professional help. Go to a counselor. Take your husband with you. Take your partner with you. Take your children with you. Let them all know what you're going through.
Yeah,
And
that
you
was
can go to
actually my
that.
next question because, like this is something which often, as you say, like, children are busy with their own lives. And then, many times, it is the husband or the family. And in the older generations, I'm not too sure whether this was kind of really brought up, probably they didn't have that much of stress, or it was all quietly born or something like that. Or anyway, now everything is heightened. So what do you think? I mean, like, how should a family support a family member who's going through perimenopause and menopause? Because most often there is just a lack of awareness, really, like, and they say that we didn't know, like, if, all this will happen. It's not so in your face.
There's a gross lack of awareness. They think that the mother is going mad, the wife is going mad. Why is she behaving like this? They end up taking them to a psychiatrist sometimes. We have seen that, so it is just menopause. Poor lady, she's suffering so much.
I know. So I think the best is that they also read up about it and understand
Yes.
what's going on. Yes,
Counseling is required for everyone, not just the mother, for everyone.
absolutely. Sure. Also, another thing which people often complain about in menopause is things like back pain. It's a common problem in many middle-aged women. I don't know if it's because of the menopause, but there is a lot of or is it might be because of the weight gain, I think. So,
Weight gain, little bit of bone loss. Yeah.
yeah, so the back pain is somehow a common thing in middle-aged and older women. So,
Yes.
what do you suggest? Like, do you think that they should go to a physiotherapist, or what are the or take some professional advice?
They should. If the back pain is bad, first of all, they should find out if there's anything else other than just, don't just ignore your pains. You should find out if there's any bone loss, if there's any, vertebra have fractures, small, minute fractures, and those are bad. And you could have some small growths also, we don't know. And posture, of course, the way you sit, the way you sleep, the way you stand and cook for a long time, then the way you stand during that time also is important. Please take help if there's a lot of back pain.
So this also brings to one more syndrome which we are now hearing about a lot, which is fibromyalgia. So this is another thing which people say that, like, I mean, I don't know really because there is a lot of talk about it, but then some
Yeah.
say it's just a mythical syndrome. So in your experience, is it like a syndrome? Because lots of women do complain of many aches and pains, and it seems to have its own characteristics.
Yes. So what they say, we're feeling tired all the day, aches everywhere. It is aching. Your bones are aching, your joints are aching, your muscles aching everywhere. So we generally try to find out their anemic, their thyroid is a problem sometimes. Sometimes plain vitamin supplementation also would do them well. See, many times our diet is not good. Even though we eat well, maybe all what is required is not coming to us.
Yeah,
All your micronutrients are not reaching you.
and in this age, there's also this compulsion to always kind of maybe lose weight. So probably some of those diets are also not quite.
Lacking. Mm. So a little bit of multivitamin supplementation would be good.
Okay, sure. Anything else, doctor, that you would like to tell our viewers?
Yeah, see, basically, you should be able to enjoy your menopause. Another thing I wanted to tell you is that there are some people who do become pregnant. So just because you have irregular cycles, it doesn't mean that you will not become pregnant. Please don't ignore your contraception. And many people don't like using condoms or anything. So, and many people have this bleeding issue. So there is a newer contraceptive which is like a copper T with progesterone, that means hormone in it. It is called Mirena. We advise that for many people. It takes care of your contraception as well as your bleeding. So contraception is never to be taken lightly.
Okay.
That is one thing. And the other thing is, try to read up about it, try to understand this so that you can, once you understand, you will be able to cope better.
Yes.
And some of these phytoestrogens, they're available at home. All these roots, I don't remember the English words now, but you can Google and find out all these phytoestrogens. Most of them are available at home. All these yams, basically it is the roots, the succulent roots which are good for you. They are all available, and make use of them. Take care of yourself. It is not always your family which should be a priority. You also are important. First, take care of yourself and then your family. I mean, you should give at least some importance to yourself. Keep some time for yourself. Go out with your friends, find new hobbies, read new books, start painting, singing, anything to keep yourself happy. And if you can, start working. There's no way that you should not work when you're slightly older. Your children have all gone. You have plenty of time. Start working. Find out a job which is suitable to you.
Yes, we have heard of many success stories of women who started after their children finished college and went away and then became such successes. So those are truly inspiring words. And so thank you so much, Dr. Nambudri, and dear viewers. I do hope that you have enjoyed this session, and you know that you can reach out to us for any support, any assistance, any help, either through our social media channels or into our hospitals and clinics and our network, and also through our apps. So we are there always to help you. So yes, some just cruise through it with very few problems. Some have symptoms that are so severe that life is intolerable sometimes. Some may feel very liberated, and then some may be sad that that phase of womanhood is lost. But whatever it is, menopause is experienced differently by each woman. But coping well is always an option, and it will depend on everything that you do, the lifestyle modification that you follow, the medical help that you seek. So, as doctors said, it is your body and you are an individual, and you need to put yourself right at the middle of it so that you can be healthy not only for yourself but also for your loved ones. So, now you know how to breeze through perimenopause and menopause. So take care and be well and be healthy. See you soon. Namaste and thank you.